Did you know your kidneys can be struggling even when everything seems normal? You might still be peeing fine, but important things could be happening inside your body. I'm going to show you a simple example of how a normal kidney should work and how a damaged kidney would work using some basic kitchen items and beads. This first example is how a normal kidney works. The measuring cup represents your blood circulation, and the beads in it represent some important components. The yellow beads represent wastes, including electrolytes your body doesn't need. The green beads represent protein, and the red beads represent red blood cells. The colander represents one of the million filters the kidney has. The bowl represents what will end up in the toilet after urination. Now let's see what your kidneys are supposed to remove. This pore represents the blood circulation through the kidney. In healthy kidneys, the filters are very selective. They let wastes and extra fluid pass through. Here you can see that the kidney has held back the red and green beads that represent red blood cells and protein, which your body needs to keep, while allowing the wastes represented by the yellow beads to be removed from the body and into the toilet. You can see in this measuring cup, there's still blood here with more wastes that needs to be removed. This process doesn't happen just once, it repeats over and over. Your body is constantly making wastes from things like the food you eat and from normal muscle activity. This next example shows how a kidney with damage works. I'll be using the same kitchen items so you can easily compare the difference. In this damaged kidney setup, the measuring cup still represents your blood circulation, and the beads represent those same components. The yellow beads represent wastes, including extra electrolytes your body doesn't need. The green beads represent protein, and the red beads represent red blood cells. And the bowl still represents what ends up in the toilet after urination. Now let's see what happens when the kidney filters are damaged. The pore still represents blood flowing through the kidney. In damaged kidneys, the filters are no longer as selective. They may still let the same amount of fluid pass through. But now you can see that some of the green beads representing protein are no longer being held back and are starting to leak through. And occasionally, even a red blood cell or two may leak. And even though urine is still being made, not as much of the wastes are being removed from the body. You may see fewer yellow beads making it into the bowl. So even if the amount of urine looks about the same, it doesn't mean the blood is being cleaned properly. And in some cases, the kidneys may not release as much fluid. When that happens, fluid can build up in the body, which may lead to swelling in the legs or even shortness of breath. You can see in the toilet that a lot less fluid has left the body. So even if the amount of urine looks about the same, it doesn't mean the blood is being cleaned properly, because wastes can still be left behind in the blood. When wastes and extra electrolytes are not removed the way they should be, they can build up in the body. This is why a provider may need to adjust medications or diet to help keep those levels in balance.
An important point to remember is that kidney damage doesn't always mean things will rapidly get worse. Out here, everything works to stay in balance. The water keeps flowing, helping to clear things out and support a healthy environment. Your body works in a similar way by creating a healthier environment inside your body through the right habits, medication, and care. You may be able to slow down chronic kidney disease and feel your best. That's what this kidney education road trip is all about, helping you take steps to protect your health. See you in our next video.